Welcome to today's Wellness Wednesday with Oriant. My name is Anne, and I am a health coach here at Oriant and also the webinar moderator. And we are so grateful to have Dr. Kaylan Baban with us again. She joined us last month and taught us a lot about mindfulness and the mind-body connection, and she's back again today with us to also share her insight. She is a doctor at George Washington University, where she specializes in mindfulness and preventative medicine.
So my role at George Washington University, as you mentioned, Anne, is serving as a preventive medicine and lifestyle medicine physician there. So I run our lifestyle medicine program, and I'm also serving as our chief wellness officer for the School of Medicine. So the areas that I focus in and that really kind of keep me moving day to day and get me really excited are on all of the things that affect someone's health that are related to day-to-day life. So not things that happen in an exam room, not necessarily things that we are writing prescriptions for, but just the day-to-day choices that we make that we know can have an enormous impact on our health and can either prevent us from getting sick in the first place, or can help us to return to a state of health and really prevent us from developing any further health problems once they've arisen. So those are things like dietary habits, physical activity, sleep, stress management, mind-body tools. These are all things that we know have an enormous impact on our health and the kinds of health conditions that we either develop or manage to avoid. So those are things I get really excited about, and I'm always happy to speak with people about. We know that when we are experiencing a great deal of stress, that stress, either acutely or certainly chronically over the long term, has a real effect on our health, on our physical health as well as emotional. And these are some examples of health conditions that we know can be exacerbated by stress. Similarly, though, we know that engaging in mindfulness practice and having a practice that you engage in regularly, ideally for at least a few minutes once or twice a day, also can really make a difference in these same health conditions and can help to better manage them and, in fact, in some cases, help to reverse them. Next slide, please. So if we speak about living mindfully, what is lived mindfulness? Next slide, please. What we spent some time speaking about in the last session was the concept of engaging a relaxation response through use of mindfulness practice, which is the opposite of our stress response in the sense that it is part of what we refer to as our autonomic nervous system that results in reducing our heartbeat, reducing our respiratory rate, reducing all of those stress and inflammatory markers and bringing us into a state of physiological relaxation. So that's one of the things that results when we are living a mindful life, including the use of these mindfulness tools. The other thing that can happen is that we can really be much more effective in changing behaviors or patterns of behavior that we want to change and in sustaining those changes. If we go to the next slide, I think this is a quote that can help us to really better understand why that can be. Why is mindfulness so supportive of behavior change? This is a quote from R.D. Laing, and we'll just read it here. The range of what we think and do is limited by what we fail to notice. And because we fail to notice that we fail to notice, there's little we can do to change until we notice how failing to notice shapes our thoughts and deeds. And if we imagine any of the types of behaviors that we sort of do habitually without even thinking about it, that we may not even know why we're doing, that may not be the healthiest for us, this suddenly becomes a very relevant quote. And I think you can understand here how the use of mindfulness practice and really living your day moment to moment as mindfully as possible can really help to support and sustain those kinds of behavior changes you may be interested in starting to incorporate, including really just helping you to be more aware of when stressors are arising and managing them proactively, which is oftentimes where a lot of our not so healthy behaviors derive from. So when we're speaking about lived mindfulness, what this is really referring to is a state of mind, a state of being, and a way of behaving. So this would include being aware of our own needs as they arise, instead of sort of continuing to push past them and maybe not being aware of them until they really rise up and won't be ignored. So being aware of our needs and being intentional in providing our self-care. Being present in a mindful manner with all the people in our lives, be that our clients, colleagues, friends, family, strangers, being aware of our surroundings and present with them. And also really bringing attention to systems and institutions that could support and promote mindfulness and thinking a little bit structurally about what it is that we can help to move the needle on there. When we are running around town or running around our offices or running around our homes or wherever we're running around, usually, of course, we're running around, right? And generally speaking, the vast majority of the time, if we are not intentionally being mindful, we are probably mindless, meaning that we are probably not really aware of our surroundings, not really aware of the people around us, not really aware of how we are feeling. Our minds are often running on what we need to do later in the day, what we should be doing now that we aren't doing, what went wrong earlier today that we wish had gone differently. We're usually doing 50 different things at once. That's exactly what I'm referring to. So the idea is being able to really be intentional about what you're doing, rather than the phenomenon of suddenly arriving where you're going and having no idea how you got there, for example. So you can imagine that means that there are a lot of missed opportunities, for one thing, for engaging with others around you. It also means that there are a lot of missed opportunities for really better understanding and identifying what's happening with you and what you need. And I think there's a fallacy that when we are in that state, we are more efficient. But we know that that tends not to be the case. Regular mindfulness practice and scoring higher on mindfulness surveys that have been validated is actually much better correlated with having better cognitive function, being more attentive, being more efficient, having greater productivity.
Excellent.
So we just feel like we're being busier and more efficient when we're running around in zombie mode.
And it just all gets real complicated at that point. Awesome. I love it.
Okay, so yes, let's go to the next slide then. So as you can imagine then, the implications here are not just for ourselves, but also for the people around us. So to use your phrase, Anne, most people don't think of zombies as being the sort of warmest, most caring people. When we are being more mindful, when we are taking better care of ourselves and what we need, that kind of self-care really can have important implications for the people around us and can be a very selfless act. So we know that when we are practicing mindfulness regularly, consistently, when we are more mindful in our day-to-day lives, that has the impact that we are more present. In being more present, we are more empathic. We are less emotionally reactive, so meaning instead of sort of quick knee-jerk reflex reactions or to any triggers that may arise, we can really be more intentional in our responses. And we can be more effective role models for the folks around us. So that's the whole do as I do, not as I say. So the next slide, please. We also know that when we are engaging in this kind of self-care and awareness of our needs, awareness of our inner emotional state, there's a big boost to professional performance. And so we've just been speaking about some of the reasons that that might be true. This is obviously not in a completely scientific graph here. Complete meltdown is not a medical term. But what we're describing here is essentially the idea that everyone has a kind of peak area of performance. Everyone has an area where they have just enough stimulus, just enough stress, that they really have something to work on, something to motivate them and keep them focused, and yet have not crossed over into an area where it's too much. And for everyone, that's a little bit different where that zone is. But the more that we are able to be aware of where we are and what we need and use that awareness to kind of self-regulate with some of the tools we'll be speaking about in a minute, that actually really helps us to stay within that range of our optimal performance and has been shown to really boost professional performance. So again, mindfulness practice can take a lot of different forms. There is no one way that you need to engage with this. If yoga or Tai Chi are things that you hate, that's fine. You don't need to decide that you love yoga in order to get these benefits. There are other things that can work well for you. And we can speak about some of that a little bit further. But when we're really getting down to practicalities, what does the practice really look like? We know that consistent practice is really the key. So not just practicing once or twice a week, not just when you feel like you really need it. It can be helpful in those situations, but you're going to get the most benefit, and especially those long-term benefits that we had spoken about in last month's session, if you're really consistently practicing once or twice a day. And you can derive benefit from as little as 10 minutes a day. That's a study that recently came out that demonstrated this, and I've seen this with my own patients as well. And again, this can be formal practice. It doesn't have to be. But what I recommend to my patients, and what I think is really backed up in the evidence, is if you have a consistent practice 1 or 2 times a day, and then are really trying to bring an informal practice throughout your day. And so that informal practice of really just being aware and present as you go about your day-to-day business. This can be throughout your day, and then having specific practices that you use as needed when you're noticing that you're just not that present, or maybe your stress is coming up.